Many people go to the doctor for issues with their ears, whether it's pressure or popping or muffled hearing. Here to talk about ETD and how to know if you have it is Dr. Wells from Columbia Breathe Free Sinus and Allergy Centers. We're glad to have you.
Thanks. I'm excited to be here, Madeline.
Wonderful. So let's get into the topic today. What is ETD?
Yeah, a lot of people aren't familiar with that. They know their ears bother them, but some folks haven't heard about Eustachian tubes. It's simply the tube that connects the air pocket behind the eardrum with the back of the nose and sinus. And its job is to allow air to move in and out to keep the air pressure behind the eardrum equal with the outside pressure. And when it's not doing its job, then a lot of pressure can build up behind that eardrum. So patients will come in and complain about just ear pressure, about popping a lot, their hearing is muffled. Often they can have ringing in the ears. They can even have a little bit of dizziness and off balance, and they don't feel like they can clear their ears very well. And they often can develop fluid behind their eardrum in that space when they have a head cold or some allergies or sinus flare-up. So it can really be aggravating for patients when their ears are bothering them. Some of the causes of Eustachian tube dysfunction are just things like anatomically, it may just be too tight. And some people, that's just the way their Eustachian tube developed. Some other things that can affect the Eustachian tube and just make it too stuffy and congested are things like allergies and sinus problems, or if they get a head cold, and then that Eustachian tube gets blocked up and can't do its job.
So how can someone find out if they have ETD or if it's another issue?
It can be a little tricky, distinguishing between, do I just have an isolated ear problem, or is it a Eustachian tube issue? One of the ways that I kind of talk to patients is that if you're popping your ears a lot, trying to blow air into your ears, you probably got a Eustachian tube trouble. If you often have trouble when you get a head cold or a sinus infection or an allergy flare-up, that's usually those things causing congestion in your Eustachian tube. So those are simple ways to kind of check. The other way is if you come see us at Columbia Breathe Free, we can look at your eardrum from the outside and just assess the health and the appearance of the eardrum. We can check hearing and things like that. We can also peek inside the nose with a little bitty camera that's very comfortable, but we can see where that Eustachian tube opening is and how does it look. Is it congested or inflamed? And then we can do a simple little pressure vibration test. You just put a little earbud in and it does this little thing, you hardly feel it, but it tells us what that pressure is behind the eardrum, and patients with ETD often have either a blunted or a negative pressure back there.
Oh, wow. So what are some of the solutions that you offer to patients who have ETD?
Yeah, we always talk about using some medications first if we can. Nasal sprays, antihistamine sprays, steroids, decongestants. They're not a great remedy. Studies have shown that only about 15% of the time do just medications clear up ETD. So usually patients are looking for a more long-lasting treatment. So we certainly want to address any allergy or sinus trouble. So we evaluate that when they come in to see us. But if we've gotten all that resolved and all that's under control and they're still having ETD symptoms and their Eustachian tube's not working right, then we can offer a simple solution. We use a little bitty balloon catheter, and you can just slip it into that opening of the Eustachian tube there at the back of the nose and gently dilate that Eustachian tube open. And so now the Eustachian tube can open and close normally. That little balloon comes right back out. It's a simple procedure that takes 15 or 20 minutes.
Wow.
Patients are very comfortable during that time. And when they're done, they can leave and go back to normal activities, normal exercise right away. So very simple and a pretty cool treatment.
That is really cool. And I bet people are just so relieved once, they don't have those issues anymore.
Oh, it's one of those symptoms along with being able to breathe that patients are so happy when their ear's not bothering them. And I have a great story. This grandfather came to see me and he said, my wife and I like to go out and visit our grandkids in California. She goes out every 3 months.
Wow.
I only go once a year because my ears are so painful. So patients with ETD, they have a lot of trouble when they fly.
Right.
And so when the plane goes down, they can have a lot of pain and pressure. Well, we did his treatment the next day because he was leaving in 2 days for California. He called me from California and he said, "You've changed my life. I can go see my
Wow.
grandkids as often as I want now."
That's
And
amazing.
so it's just really rewarding when you can help people like that.
It must be. That makes me so happy to
know.
hear that. I mean, it just makes it all worth it, I'm sure.
It does. So we get many stories like that, and that's what really drives us and keeps us going and doing what we love to do.
Absolutely. Well, if you want to be one of those success stories, what's the best way to reach out?
You can reach us on our website at columbiabreathefree.com, or you can call us and get an appointment the same day at 803-233-7763.
Wonderful. Well, thank you so much for sharing that with us today.
Thanks for having me, Madeline.